A very good morning to everyone. I am Jinaresh from Easy A section. I am studying in IARE College, third year, 5th sem. This is the PPT of Wireless Communication and Networks WCN subject. My Tech Talk topic is about from micro to nano, the evolution of wireless sensor based healthcare. Let's get into the topic. Over the past decades, embedded systems and micro electromechanical systems have developed in a radical way, redefining our standard of living and enhancing the quality of life. Healthcare, among various other fields, has benefited vastly from this technological development. The concept of wireless psychological sensor nodes, however, gained popularity in the mid 2000s with the sensor data from the node transmitted to the hub via a wireless medium. The network formed by this heterogeneous set of wireless body sensor nodes is termed a wireless body area network, which is shortly known as WBAN. Each wireless body area network is essentially a composition of multiple wireless body sensor nodes on a single hub. The hub is primarily responsible for the acquisition of raw sensor data from all the component sensor nodes. The first level aggregation of the data before transmitting the aggregated data for further analysis to a remote data acquisition center. This increasingly elder population suggests that by 2050, elderly health monitoring will be a critical issue, posing serious challenges to conventional medical practice and technologies. Wireless body area networks could provide seamless, ambitious, and remote health care and therefore prove to be highly effective in the context. The wireless body sensor nodes are immature in size, composed of several micro order components. These sensors are planted on a patient's body, and patient is allowed to move or perform his or her regular activities while being monitored and on a continuous basis. Patients suffering from the chronic diseases such as heart and lung diseases demand long-term periodic follow-ups and use the wireless heart rate and electrocardiogram, which is shortly known as EKG sensors, allows for the real-time analysis of patient's condition. The network architecture of wireless body area networks based medical care is in a hospital environment is shown in the figure 1. This is the figure 1, which represents the wireless body area network based medical care in hospital environment. So here we can observe that the internet, by internet, the in the medical ward there are patients, and the patients are observed by a proxy server. A wireless accelerometer sensor helps is fall detection for elderly people living alone. The wireless sensor nodes are usually integrated with the clothing in the form of a vest or band, which is patient is made to wear. In some cases, however, the sensors are simply patched onto the patient's skin, and assistance from the paramedic immediately after the patient is aboard on an ambulance. A wireless body area network is a collection of heterogeneous sensor nodes that are linked to a single hub acting as a local data aggregation and processing unit. A hub can be conceptualized as a portable device such as a simple smart mobile phone or a tablet or a personal digital assistant which is capable of connecting the internet. Based on the placement of the wireless sensor node, wireless body area network is classified into two broad categories: one on body wearable wireless body area network and implantable wireless body area network. Long-term health monitoring of chronic patients, heart, smart hospital-based patient treatments, and ambulatory healthcare assessment of soldier health and fall detection for elderly people are a few of many applications of on-body wearable wireless body area networks. From macro to nano technology, although micro ordered body sensor nodes have been significantly advanced healthcare options, these wireless body area networks have restricted applicability under certain constraint situations. The component sensors of a micro-scale wireless body area networks are unable to provide absolute invasive medical care and also fail to provide cellular level precision in measurement and acquisition. Invasive healthcare using this wireless sensor is also understood to be inconvenience in the request pressing and penetration of the patient's body. The latest advancements in the nanotechnology have been proved that suitable solution is the aforementioned limitations and micro scale wireless body area networks based healthcare. Nanotechnology enables fabrications of device in the scale of 1 to 100 nanometers. The difference between the traditional wireless sensor networks and the nano sensor networks is the data acquisition speed. In the case of former, signal are transmitted and the speed of light, whereas in the case of nano biosensor networks, information transmission is heavily dependent on the mode of communication. The direct application area of the wireless nano biosensor network is field of medical science include the following: health monitoring. Nano sensors are able to offer precision in the cellular level to provide a better idea regarding the precision offered by the sensors. Note that a nanobiosensor node is able to distinctly measure pH at the two different places with a single cell. Measurement of oxygen and the cholesterol levels, identification of cancerous cells, and diagnosis of hormonal disorders are a few of the tasks able to perform by wireless nanobiosensors. Delivery. Drug delivery. The precision drug delivery is another important applications of wireless nanobiosensor networks. Smart nano actuators are used to deliver drugs invisibly without external interference. For example, smart instance nano actuators can consequently monitor the blood sugar level and inject pre-calculated amount of insulin upon determination of insulin deficiency. Other examples include treatments of cancerous cells using cellular level chemotherapy. Immunity support. Special types of nanobiosensor nodes are identify the presence of foreign bodies and pathogens within the human body and are capable of responding against the miscellaneous cells and resulting in the disease treatment. that is localized, less aggressive, and less invasive. However, practical implementation of wireless nanobiosensor networks based healthcare is yet to be realized. However, with the advancements in interdisciplinary research, nanotechnology will extend its applicability and impact on various fields, and in the future will revolutionize the scientific and technological community and in the turn of human life. Thank you.